Hey, Mr. Jones. My name is David. I'm your nurse today. Can you tell me your name and date of birth?
My name is John Jones, and my birthday is January 1st, 1990.
So before you leave the hospital today, I wanted to talk to you about your medication, Ritalin, which is also called methylphenidate. This drug comes in a tablet, a capsule, a skin patch, and in liquid form, and your doctor's starting you out on the chewable tablets.
Why did this doctor order this medication for me?
Your psychiatrist prescribed you this medication because he believed after talking with you that Ritalin is the best treatment option for you. It's the most common medication used to treat symptoms that you've been experiencing from your attention deficit hyperactivity disorder diagnosis, which is also called ADHD.
Do you think it will really help me?
Right now, your body's wanting to work a lot faster than your mind can keep up with, and this medication is going to help speed up your brain activity to where your body is working together the way that it's supposed to. Ritalin is proven to be effective for a lot of other people, so there's a very good chance that this will help you too.
So this medication will make me feel normal?
Right. This should help you get back to your normal self again.
When would I have to take this medication?
The chewable 5 milligram tablets you've been prescribed, you'll need to take twice a day, every day. You want to take the first one about 30 to 45 minutes before your breakfast, and the other one about 30 to 45 minutes before dinner. Just make sure you don't take them after around 6 o'clock because this might make it difficult for you to fall asleep. You'll also want to drink at least 240 milliliters of water right after you drink this, so that's about this much.
Do I need to eat or drink something special when I take this?
That's a great question. If you're a big coffee drinker or if you like energy drinks, you're going to want to try switching to decaf and avoiding as much caffeine as you can.
What problems do other people complain about when they take this?
Just like any other medication, there are certain precautions that anyone taking this drug should be aware of. Some of the most common side effects are dizziness, headache, upset stomach, nervousness, loss of appetite, and insomnia or difficulty falling asleep. There's also a small chance that you might experience something called a priapism, which is an erection that lasts longer than 4 hours. It's a very rare side effect, but if it happens, you want to go to the doctor as soon as you can.
Do I have to avoid anything while I take this?
Being that you've not taken this drug before, you should avoid any activities that require a lot of concentration or alertness for the first few days. As soon as you know how this drug affects your body, you can then figure out what you should or shouldn't do. You'll also want to be sure that you're not taking any MAO inhibitors within the last 2 weeks of starting this drug.
Would this drug affect my libido anyway?
Ritalin is a stimulant, which is a drug that raises mental and physical activity in the body. Everyone's body is a little different, so there have been varying effects reported. Some say that this increases libido, while others have noticed a reduced sex drive. You may not notice a difference at all, but if you do, you can always talk to your doctor and figure out the best options from there.
What does my sister need to know about? She lives with me.
Everything I've shared with you today is something you can talk to her about. I've actually put it all together in this information packet that you can take home with you today. Be sure that you've read over everything when you both have a minute, and also don't stop taking this without talking to your doctor or pharmacist first. And if you decide you want to start any new vitamins or supplements, you want to talk to them first just to be safe, okay?
Okay, that makes perfect sense.
Great. Here's that handout, like I said. Read over this when you have a minute. It might help you learn something else that we may not have talked about already. If you have any other questions, here's a phone number for you to call.
Great. Thanks for being the best nurse in the world.